Good afternoon, everyone. The topic of the presentation is anterior capsular bulging sign and flat cataract sign, the two diagnostic signs of lens coloboma. The chief author is Dr. PARTHASARTHI Roy, and I am Dr. Milli Mandal, Junior Assistant, Calcutta National Medical College. I'll be presenting on his behalf. Eye surgeons need to be familiar with the presentation of lens coloboma in order that they can better plan a cataract surgery on a colobomatous eye. Our objective is to present two new diagnostic signs of lens coloboma on slit lamp examination. To the best of our knowledge, there is no telltale diagnostics clinical sign for the diagnosis of lens coloboma, or the zonular coloboma to be precise, till date. And ours are the first such diagnostic signs. So here, we are presenting a case of a non-diabetic, non-hypertensive male patient, aged 63 years, presented with dimness of vision in the right eye since childhood. His vision started to deteriorate 4 to 5 years back when he noticed something white in his eye. On examination, the right eye showed a BCVA of 6/36 and an NCT of 18 mmHg. We found an infranasal coloboma of iris and a pie of white cataract in the colobomatous area, with an amber to black nuclear sclerosis elsewhere in the lens, which we termed as flat cataract or double cataract. So here we can see that in the right eye, there is an infranasal coloboma of iris and a pie of white cataract in the colobomatous area, with an amber to black nuclear sclerosis elsewhere in the lens. So on slit lamp examination, anterior capsule was seen to be bulged anteriorly in the colobomatous area, which is the anterior capsular bulging sign, with cortical matter also followed the capsular bulging. To the cataractous lens, we found a fundal coloboma. It was also noticed in the indirect ophthalmoscopy, and the left eye was within normal limits. On slit lamp examination, the anterior capsule was seen to be bulged anteriorly in the colobomatous area, with the cortical matter also following the capsular bulging. Coming to the discussion and conclusion, the term coloboma of lens is a misnomer. It is actually zonular coloboma. In the area of zonular coloboma, the zonules are either weak or absent. Relieved by the pull of zonules, the elastic anterior capsule bulges forward, which in turn gives rise to this anterior capsular bulging sign. And as this change in the capsular shape, it occurs very early in life, the plastic lens matter, which lies underneath, also bulges forward. So due to this difference in the architecture of the lens, the two types of cataracts, they develop in the colobomatous area and elsewhere in the lens, respectively. Although some schools depict the notch in the extreme periphery of the lens as coloboma, this actually represents the depression below the bulged anterior capsule and not the true notch in the lens. So hence, this can be called a pseudocoloboma of lens. So this is the picture where they're showing that this is actually the supranasal lens notch, which is visible in the retroillumination. But if we do a slit lamp or the oblique section, optical section, we will get to see that there is an underlying defect, which in turn results due to the anterior bulging of the lens and not due to the defect of the lens matter. With this, I would like to conclude that the only real valuable thing is intuition. The intellect has little to do on the road to discovery. Thank you.
You are saying slit lamp, we can always see it. Is any other thing now coming up we have with us? We can also find the coloboma, or we can see the anterior capsular bulging. We have so much armatorium with us. Any other things through which we can also know it?
Anterior segment OCT, ma'am?
Yeah, so that also can help us.
Yes. Yes.
So what more exactly you wanted to see us through slit lamp? We always examine and we get to know. So what is your message which you want to give in this?
Ma'am, the basic message that we want to give in this is that it's very important to identify the colobomatous lens, and this is a sign where we are saying that it is not due to the zonular deficit, it is due to the lens capsule bulging. So this is this is a sign which will help us to identify and detect lens coloboma on slit lamp examination, which in turn is going to help us in planning these cases beforehand for the surgery.
Because lens coloboma, we anyway get to know it. So what other thing will this add to us? That is what. Surgically, anyway, we know this is a lens coloboma and we are going to go about with our surgical technique. So this finding which you are saying, what extra is it adding to your literature or to our study, or how do we handle differently? That is what I just wanted to know.
Management is definitely not going to be different per se.
Okay.
Okay, thank you so much.